मेरे प्यारे फार्मेसी के साथीदारों, आपका कलर्स फार्मा में अभिवादन है। आज हम एमसीक्यू डिप्लोमा लेवल के देखने वाले हैं, पर जो मेरे नए साथीदार आए हैं उसको गुजारिश है कि इस चैनल को सब्सक्राइब कर दीजिए और ये बेल आइकन भी प्रेस कर दीजिए ताकि जब भी मैं नया वीडियो अपलोड करूं आपके तक तुरंत ही पहुंच पाए। देखते हैं क्वेश्चन नंबर 1। विच ऑफ द फॉलोइंग ड्रग एक्ट बाय इनहिबिशन ऑफ न्यूक्लिक एसिड सिंथेसिस? Acyclovir, Amantadine, Guanidine Methimazole. The most appropriate is Acyclovir. Methotrexate used in which category? Antiviral, antifungal, antiamoebic, anticancer. It is used as an anticancer. Mechanism of actions of methotrexate is antagonism of folic acids, antagonism of nucleic acid, antagonism of amino acids, not clearly known. So correct one is antagonism of folic acids. Which of the following is naturally occurring anti-cancer drug? Cisplatin, Camptothecin, Vidarabin, Carmustine. So correct answer is Camptothecin. Salbutamol used in which category? Antihistaminic, antifungal, antiamoebic or anticancer? It is used as an anti-asthmatic drug. Which one of the following is H1 receptor antagonists? Cetirizine, ranitidine, strychnine or atenolol? The correct one is cetirizine. Which is the example of CNS stimulant? Amphetamine, atenolol, atropine, D.Pharm. The correct one is amphetamine. Question 8. Rotarod test used for which study? Tranquilizer drug, malaria drug, diuretic drug, diabetic drug. So this test is used for the tranquilizer drug. Which is the example of oral antidiabetic drug? Glipizide, ibuprofen, methotrexate, furosemide. The correct one is glipizide. Which is the example of diuretic drug? Glipizide, ibuprofen, methotrexate, furosemide. So correct one is furosemide. Levodopa used in which of the following diseases? Parkinsonism, Alzeimer, depressions or epilepsy? The correct one is Parkinsonism. The ability of drug to initiate the effect is termed as half-life, affinity, intrinsic activity, synergism. The correct one is intrinsic activity. Which of the following is not example of analeptic? Caffeine, theophylline, picrotoxin, domperidone. The correct one is domperidone is not example of analeptic. Identify dopamine receptor agonist. Amantadine, salicyline, carbidopa, bromocriptine. So the correct answer is bromocriptine. Identified mechanism of action of salicytes. Inhibition of prostaglandin synthesis, inhibition of RNA synthesis, inhibition of DNA synthesis or inhibition of nucleic acid synthesis. The correct one is inhibition of prostaglandin synthesis. Identify non-narcotic analgesic. Pethidine, phenacetin, meperidine, pentazocine. The correct one is phenacetin. Symptoms of morphine poisoning except pinpoint pupil, failing breath, cold skin with cyanosis or gastric discomfort. So the correct one is gastric discomfort. Adverse effect of phenytoin produce the deficiency of which vitamin? Vitamin A, vitamin B3, vitamin B6 or vitamin D? The correct one is vitamin D. Which of the following insulin preparation has a longest duration of action? Semilente Isophane Lente Protamine zinc. So the correct one is protamine zinc. Identify sulfonylurea drug, fenformin, pioglitazone, glipizide acarbose. The perfect one is glipizide. तो ये हमारे थोड़े अटेम्प्ट थे कि आपके तक पहुंच पाए। अगर आपको ये वीडियो अच्छा लगे तो यू कैन शेयर, लाइक एंड सब्सक्राइब with another student also. Thank you. Thanks a lot.